Okay, so I take my bandage. I take my splint. So what I have to do is just do a bit of optimal loading, looking at your face, how you respond. Are you getting it? So optimum loading is just to try to, because I'm protecting the joint already while I'm doing some optimal loading. So it's to try to allow blood circulation. Are you getting it? Then after optimal loading, I make sure that I take ice. So let us assume this is my ice. Then just around. So ice is our painkiller in first aid. Ice also reduces swelling. So we need to reduce swelling on the sprained area as well as to reduce what? Pain. Yes. Then when that is done, I can take my bandage and put a bit of compression. So as also to reduce what? Swelling. So I just have to compress. Then I take my splint. You can even take it like this way. Then, so in most cases you can even take cotton for padding. Yes. So cotton will be there for padding so that the splint will not settle directly on the skin because it might cause more pain. Then I have to secure my splint properly so is that it will serve its purpose. Okay. Okay. I can even use a safety pin, but this is easy for me to secure like this way. So I secure. Then from there, unfortunately, you have a bandage, but I was supposed to do some capillary refill test. So capillary refill test, some they call it a nail bed test. It is meant to check if there is circulation, because it might happen that my bandaging is too tight. It stops circulation of blood. So if we stop circulation of blood because of tight bandage, it can result in amputation because these nerves will start to die one by one. So we have to make sure that after every bandaging, whichever wound, whichever injury that we're going to discuss, we must not disturb circulation. So that is why we do capillary refill test. Then when we see that the circulation is fine, we keep it elevated. I take my triangular bandage. Let me just use this one. So this is my triangular bandage. So the pointing party and the elbow. So we just slide it, I slide it in. I take this one. I adjust it accordingly to what I want to achieve. Then here at the back, I will tie what we call a reef knot. I will tie what we call a reef knot. So a reef knot is easy to untie in case of any emergency. So I can take a safety pin. I can take the safety pin. Do I have one? So the safety pin will be here in this manner, so as to secure. Let me just look for. So this pack comes without a pin. Why? Oh, it's here. So I utilize. So I can take a safety pin. So you make sure that you do it carefully so as not to injure the patient, né? Yes. When you are using your pin. Okay, you can stand up. Showing us how it is. So in case if you feel any pain, I can adjust. Depends. Or we can even do like this way. So it depends on how we want to keep it elevated. Sometimes we can just put it in this, depends on the situation. Then it's a if not again. So it's a if not. So if not is a knot which can easily be untied. So if you look at this one, you can adjust. Depends on what you want to achieve. So this is what we call a sling. So a sling keeps your eject part elevated. Then a splint immobilized to avoid movement of the fractured, sprained, or strained party. That is why we split. So this is it. Any questions? Nope. No questions. Thank you. I really appreciate, guys. So it's practical demonstration. It's part of the training.